Hi, I'm Dr. Federo. I'm a board-certified plastic surgeon who does a large volume of facial rejuvenation. We know that as we age, we lose facial volume. So as we go through life, we have all kinds of changes in the face, and those changes involve the skin, the subcutaneous fat, the soft tissue such as the muscle of the face, and even the bone changes over time. So one of the things that we've learned about facial rejuvenation is that we need to restore, oftentimes, the volume of the face, because we need to replace the lost volume to create a more youthful, pretty, or handsome face. So today I'd like to talk about the relative merits of the various techniques to restore facial volume. One of the things that I do as a plastic surgeon is I do fat grafting. And what fat grafting involves is harvesting fat. So I take fat from one part of the body, and that involves a meticulous procedure to gently remove fat. It can be from the abdomen, it can be from the love handles, really any spot where there's a little bit of excess fat. So we remove fat meticulously, and the fat can be processed in different ways. One way of preparing fat for facial injection is to take the fat that's been removed, put it in a centrifuge, and spin it. And when you spin the fat, what happens is that you get a little bit of the fluid that you use to harvest it out. You will inevitably have some fat cells that will break down, and there'll be some oil, and you take that out because you don't want to inject that into the face. And what you're left with after centrifugation is a very pure fat that doesn't have too much fluid in it, that doesn't have oil in it. And those healthy fat cells can then be entered into a small syringe, and with a small little cannula, that fat can be injected into any part of the face that you like. Fat can be taken from one part of the body, processed in some way, and then that pure fat can be meticulously injected into the face. So fat injection is a technique, and a technique can be done poorly or it can be done with expertise. So other than surgical harvesting of fat and injection, there are other ways to augment the lost volume of the face. There are a variety of commercially available fillers. So we know that we can take one of these excellently designed fillers, whether it's hyaluronic acid or another product, and we can take that, we can add that to places that have become deficient. So hyaluronic acid is probably the most commonly used filler in the world, and it's certainly the filler that I use most commonly in my practice. And what's nice about commercially available fillers is that you can come into the office, you can have a little topical cream put on your face, or no cream, get a little bit of general anesthesia of the skin. And then what you can do is you can use those fillers to augment what has been lost. The nice thing about commercially available fillers is that you can walk into an office, you can have somebody analyze your face, and you can have improvement right away. There are other things that you can inject into the face to restore volume. There are medications that can stimulate your body to make collagen. And so these are a bit of a hybrid. So they aren't fillers per se. What it does is you're adding volume with medication. That medication stimulates the body to make collagen in areas that have become deficient. So you can get a nice global restoration of facial volume. So if you're using Sculptra, you can put it in the cheeks to restore a little bit of collagen in the cheeks. You can put it a little in the temple to restore some of that lost volume there. You can put it in the jawline. You can put it in the central face. And by adding this medication, you're getting the body to generally stimulate additional collagen and volume throughout. People ask all the time, you have all these modalities. You can use fat grafting, you can use fillers, you can use biostimulating medication. How long do we need to wait to see the results? What's the recovery time like? These are the important questions. If you're using a commercially available filler, like hyaluronic acid, if you are in the office, you're awake, you have a little bit of numbing cream on your skin, you will see the product enhance the soft tissue immediately. So commercially available fillers give you an immediate result. The recovery tends to be very, very quick. For most patients, there will be essentially no recovery. You're gonna have filler put in the face, you're gonna get maybe a little bit of swelling, rarely will you have bruising, you can ice a little bit, and so you can typically go out that day and you're good. If you're having your lips injected, and that would probably be the one place that I would always warn people, when you put filler in the lip, you're going to swell. And so when I do lip augmentation with filler, I will put the filler in, and then I will tell people, you're going to swell. You're going to swell a lot in the first 24 to 48 hours. Ice your lips and don't be too concerned. So with commercially available fillers in the lip, I would tell people, give yourself 48 hours of not going to a party, of not going out to dinner, of just kind of laying back. So typically I would inject those on a Friday and give people Friday, Saturday, Sunday to be home, and then Monday they can resume normal activity. What's it like having a biostimulatory filler such as Sculptra? Like, how does it work, and what should you expect? So the typical patient who's getting one of these treatments is somebody who has enough aging in their face that they see it in more than one location. So they're going to have deficiency in the cheek. They're going to see a prominent nasolabial fold. They probably have a little bit of a jowl and a little bit of a sulcus here. They probably have some deficiency in the temporal area. So they're people that have kind of a global amount of facial atrophy. So the way it works is that you come to the office, we typically put a numbing cream on the skin, we prepare the medication, and so it comes as a powder, we add volume to it, and then typically you'll have one treatment, you'll get, say, 9 cc's of fluid injected into the face. So as soon as you leave, you're gonna look better because you have volume in your face, it's just fluid. And then over the course of the first day or two, you will swell, because anytime you have any kind of injection to the face, there will be some reaction, so there will be some swelling. So typically people will swell for a day or two, and I usually recommend ice on and off in those first 48 hours. And then after about 2 days, the swelling goes down, and they basically return to where they were after the injection. And then after a few more days, say after a week, the face basically returns to where it was before the injection. And then slowly over the course of weeks, your body will make collagen and you will restore the volume that you had at the time of the procedure. Typically, something like Sculptra will be done multiple times. So for most patients, they will get 2 vials of Sculptra. They'll get 9 cc's of fluid. And then typically they will have 1, 2, or even 3 treatments that are spaced about 4 to 6 weeks apart. And you should expect those results to last 18 months to 2 years. People ask all the time, well, what's the recovery like for fat grafting? How long does it last? How much of the fat takes? And the truth is that there's significant variability for every patient as to how long fat lasts, how long the recovery takes, but in general, there's some concepts. So in very simple terms, the more fat grafting you do, the more significant your post-procedure swelling will be, and the longer the recovery will be. So for some patients, if you take a little bit of fat, typically from the abdomen, and you add that fat to the cheeks and the nasolabial fold and a little bit of the marionette line, and say we take 30 cc's of fat from the abdomen, and then we process the fat, we may end up with 15 cc's of fat. And so that 15 cc's of fat, which is less than a shot of NyQuil, if you're just trying to get an idea of volume, and we take that fat and we put it a little bit in the cheek and here, that patient is going to swell for the first 24 to 48 hours. And after that time, they will see fullness, and then slowly over the course of a week, they will probably have some of the edema subside. And then after a week, they will see nice improvement in the cheek. Now, it is possible with fat grafting that you could have some bruising. Doesn't always happen, but I always tell people you have to be mentally prepared for bruising. For women or people who wear makeup, you can usually hide any residual bruising after a week to 10 days. So with a typical fat grafting procedure, say with a facelift or without a facelift, you can plan on being very swollen for 2 to 4 days to have a pretty reasonable amount of edema subsiding after a week. And then if you did bruise, you can usually cover with makeup after 7 to 10 days. So fat grafting of the face, if it's a moderate amount, and I would say 15 cc's is a moderate amount of fat, you can plan on looking reasonable in about 10 days. One of the things that I do in my practice, I think is the most important, is to analyze the face, to listen to the patient, and then to pick a procedure, whether surgical procedure or non-surgical procedure, that fits. And so one of the things that we see is that people come into my office and they should have had surgery. and they went to somebody who doesn't do surgery, and they were told, oh, you don't need an operation, you just need 15 cc's of filler. And so they have all this filler put in their face. They spend all this money, and not only do they not look younger, they look weird. And so why does this happen? Because I think that there's a tendency, there's a famous expression, if all you have is a hammer, everything's a nail. So if the only thing you do is inject, then every patient you see gets offered injection. And so here, at Reflections, we don't do that, because if a patient needs surgery, they see me. I'm the surgeon here, and we offer them surgery. If the patient doesn't need surgery and they are better served with non-surgical means, then we provide that non-surgical alternative. So the key in my practice, and as somebody who does a lot of surgery and also a lot of injections and has access to the energy-based devices and other providers' care, I take it very seriously to match what the patient wants, what their anatomy needs, with the solution. So when to use fat, when to use commercially available fillers, when to use biostimulating medications to rejuvenate the face, it's complicated. And I know that people, after watching this video and seeing other things online, may be confused. And the truth is that these are complex topics. But the good news is that all of these techniques are very powerful and have incredible merit for specific patients. So if you have questions, just leave them below and I'm happy to answer them. And if you come in for a consultation, we will discuss all the merits of fat grafting, commercially available fillers, and biostimulating medication.